Hi, I'm Zach. I'm
Hello.
also a student pharmacist.
So we understand that you've come in today to seek some self-treatment for a couple of the issues that you've been having.
Yes.
So is it okay if we counsel you?
Yes.
Okay. And it'll probably take about 10-15 minutes to counsel you.
Okay.
Okay. And is this area okay?
Yeah, it's fine.
Okay, good. And also, we just want to make sure that you are the person that's seeking self-care.
Mm-hmm.
So if you could start with telling us about some of your symptoms for both issues that you've been having.
Okay, so I've been having these few pimples on my face, and they seem to get worse. And same thing with my dandruff. As you can see, I have a lot.
Yeah.
And I'm really trying to treat it. That's something.
Okay.
It's going to help me.
Yeah, for sure. We can definitely help you with that.
Okay, so what are some of the characteristics of your acne and your dandruff?
Acne, it seems to be just. I've had it for the past few days, and I think it's just getting worse. So I thought I should just.
So is it like mainly pustules, or is it like whiteheads, blackheads, or pustules?
Mostly blackheads and whiteheads, and a little bit of pustules.
Okay. And what about, you said history? Do you have any history, previous history?
I do not.
You don't? Okay, so no previous history. And
How long ago did these symptoms start?
For acne and dandruff, just a few days ago.
2 days ago?
Yeah.
Okay. Is there any like occasion, like anything that would have brought it on?
Yeah, so I think it's my stress because I'm about to have finals in school, and this is really stressful.
Okay. And how about the location that you would say? Is it just for the acne? Is it mostly for your face, or is it other places?
Yes, for my acne, it's just the face.
Just the face. Okay. And how about the dandruff?
Dandruff, just the scalp.
Okay. Yeah. So it does look pretty severe though, because it is going down
Yeah.
your shoulders. Okay.
Okay, so what are some of the things that make it worse?
For acne, definitely I feel like it's my stress because the more stressed I get, I feel like it just gets worse.
That makes sense.
For dandruff, I feel like I'm not washing my hair correctly, and I haven't got much time to wash my hair, so because of my finals, I just don't have enough time.
Is there anything that makes it better?
Not for dandruff.
How about for acne?
I haven't tried anything.
You're trying it? Okay.
Okay. So are you currently taking any medications,
No.
like prescription, even over-the-counter stuff currently?
Herbs
What
or
about-
supplements? No. Okay. And how about any allergies?
No allergies.
No allergies? Okay.
Okay. And do you have any chronic health conditions that we should know about?
No.
No? Okay.
And how about for drug and tobacco use? Do you drink alcohol or smoke tobacco at all?
I drink alcohol socially.
Socially? Okay.
I don't.
You don't smoke any
No.
tobacco, so no,
No
pretty much
tobacco.
no illicit substances other than the occasional alcohol?
No.
Okay. And so now we can go on to exclusion, like the self-criteria for exclusion principles.
Okay.
And so looking at your acne, it looks like I don't really see any rosacea, just because that would be more of like blotchy redness right in your cheek area. And then also for like severity of your acne, I don't think it's moderate to severe. I would say it's more so mild because there's only a few, and it doesn't look to be too severe.
Okay.
And also, are you pregnant or breastfeeding?
No.
No. And what age are you?
I'm 21.
Okay, so you're 21. You said you hadn't previously tried any treatments to self-treat.
No.
Okay. So I think we've established that you're a good candidate for self-treatment for both of these conditions. So
Okay.
we're going to go ahead and recommend some products for you.
I'm going to start with acne. So looking at your acne, I think I'm going to recommend something that is for more mild acne, 'cause that's pretty much what it looks like. Doesn't look too severe. I'm going to recommend adapalene, which is also known as Differin. It comes in a 0.1% gel, and gel is most effective, so that would be the best for your condition. And you apply that topically in order to treat acne vulgaris, and it's going to relieve your symptoms, so that should help overall. And for the dose, it's going to be just applying it all over your face, just a thin amount of it. And formulation is 0.1%, like I already mentioned, and topically for the route. And then the frequency is going to be once daily, towards the evening, like bedtime. Okay. And the administration technique is going to be applying a thin film of the adapalene all over your face. But before you do that, you're going to want to wash with non-medicated soap, so that could be like Cetaphil or Dove. And some common adverse effects that you should be aware of are skin irritation, which usually occurs within the first month that you're using it, but it'll go away after that first month. Okay? And then you should also be aware that it can worsen your acne at first, so don't get freaked out. It can worsen it first in the first few weeks, but that will also go away with time. Okay? And some rare but serious side effects are edema, contact dermatitis, and skin discoloration. Okay? So if you see those, they're rare, but they're serious, so you're going to need to contact your doctor if you see those. Okay? And another precaution that you should take is that when you're using the adapalene, it makes you more susceptible to sunburns. So try and stay out of the sun as much as you can, okay? Just while you're using it. And then also, if you happen to become pregnant, or you plan on becoming pregnant, you should stop use of the adapalene because it can cause teratogenic effects. So that can be dangerous. So I would stop using that if you are pregnant and contact your OBGYN. Okay? And so if you do happen to miss a dose, it's not a big deal. If you're really close to the time where you're scheduled for the next one, just skip it and take the next one as scheduled. Otherwise, if you're not that close, then you can take that one as soon as you remember, okay?
Okay.
And then to store it, you should store it at room temperature, in a dry place, away from heat, and make sure that it's put in a safe place, away from kids or dogs, because if it's taken orally, it can be very toxic, okay? And so for self-monitoring for you, I would recommend taking pictures, like progression pictures.
Okay.
So start, before you start using it, take pictures so you know what it looked like before you start taking it, and then just take progression pictures so you can see how it's progressing. Okay. And some non-pharmacologic therapies that you can use would be to try and reduce your stress and to try to wash your face daily. It's really important, morning and night. Try and avoid any oily cosmetics or oily moisturizer that is just going to add to the acne and just make it worse. Okay, and then also don't squeeze your lesions. That's just going to spread it. That's not good either. So just let them be. Drink plenty of water. Exfoliate your face, and also it's important to, if you can, try and avoid dairy in your diet because that can also kind of irritate your symptoms that you already have. Okay, and then if any further symptoms occur, or if you notice that it's worsening within 6 weeks, then I would recommend that you contact your doctor or a dermatologist because that's not good if it's getting worse, okay? All right. And now we're going to talk about the teeth back method. So, can you go over what you learned?
Yes, so you recommended adapalene.
Yes.
Different, that's 0.1%.
Yes.
And I would be applying this before bed once daily. And before I apply this, I would wash my face with mild soap, so like Cetaphil.
Yeah, non-medicated soap.
Non-medicated soap.
Yep.
Adverse effects. Itchy skin.
Yeah, so that was for the common one. So for the common side effects, you're right. Itchy skin, skin irritation.
Okay. And some of the rare ones you said was edema, skin discoloration, and contact dermatitis?
Yes. Okay. And also with the common ones, don't forget that your acne can worsen at first. So don't be freaked out by that because it can worsen at first, but that'll go away within the first few weeks.
Alright.
Okay. And anything else?
Yeah, I should not go out in the sun while using this product.
Yes.
If it doesn't get better within 6 weeks, I should contact my doctor.
Right.
Okay.
And then also, it will also, you should see good results within 8 to 12 weeks if it's working the way it should. You should see significantly better results.
And I should take pictures to monitor?
Absolutely.
Alright.
And what about, let's see, pregnancy? Remember what I said about that?
Yeah, if I do become pregnant, I should not use this product.
Right,
Stop.
because of the teratogenic effects that it can have.
Yeah.
And missed doses. How about that?
If I do miss a dose, I would take it as soon as I remember, but if it is close to the next dose, I would just take the next dose, not the missed dose.
Right, just skip that missed dose, yeah. And what about storage?
Storage at room temperature.
Yes. And also just remember to keep it in a safe place, away from any
Right.
one dog or kid or anything that could ingest it because it can be toxic. Okay?
Right.
And what about some of the non-pharmacologic therapy options that I
Drink
mentioned?
a lot of water.
Yeah, it's important. Yep. Stress, try and reduce stress as much as you can.
Okay.
And wash your face daily.
Right.
Also avoid any oily cosmetics or moisturizers.
Okay.
It's just gonna add to your acne. Also try not to touch your acne.
Yeah.
It spreads it.
Right.
It doesn't really help it at all. So that's good to not do also. And try to limit the dairy in your diet. And exfoliate. That's important too. Get rid of the dry skin out there. Okay. Any other questions?
Okay, so for the dandruff, I'm going to recommend selenium sulfide 1%, which is in a shampoo form. You probably know it as Selsun Blue. That's what it's most commonly in. So it's a medicated shampoo. It's going to help your dandruff and relieve the symptoms of your dry scalp. So the dose would be considered like a hair washing treatment with the topical anti-dandruff shampoo.
Okay.
So what you're going to do is you're just going to use this instead of your regular shampoo.
Okay.
So you're just going to take a little bit in your hand, massage it into your scalp, and then you're going to leave it on for 3 to 5 minutes.
Okay.
And then it's recommended that after the 3 to 5 minutes, when you're washing it out, try and rinse it 2 or 3 times to make sure you get all of it out. So the schedule that we're going to use it on, so for the first week, you're going to use it daily. So you're only going to use this shampoo for the first week.
Okay.
And then you're going to switch to 2 to 3 times a week
Okay.
for 2 to 3 weeks.
Mm-hmm.
So whenever you're not using this shampoo, you would just go back to your normal shampoo. And then after those 2 to 3 weeks, when you're using it 2 to 3 times, you're just going to use it once a week or every other week for just a maintenance. Because hopefully by that point, your dandruff should be cleared up and you're just going to want to try and keep it from coming back. If your symptoms do worsen, the dandruff does come back, you can work back up to using it 2 to 3 times a week or every day
Okay.
to help it go back away again. A lot of people do sometimes use scalp scrubbers, which can help, kind of just cleanse it all, make sure you're getting it all in there. Some common side effects. A lot of people say that it tingles whenever they use this product. It tingles their scalp. So that's normal. You shouldn't really, it's not too bad of a side effect. Other people have also said that it sometimes burns or itches. Makes it itch pretty bad. It can also discolor your hair sometimes, and it can cause, alopecia, and then sweating. It can cause you to sweat. Some more serious side effects, it can make you feel lethargic. You can have tremors, and it can even cause GI issues like vomiting or abdominal pain. You shouldn't use this, definitely warning, you shouldn't use it if you have hypersensitivity to selenium sulfide, but because you said you never had it before, we're not really sure of that at this point.
Okay.
But if you have any of these adverse effects that are pretty bad, you definitely want to contact your doctor for further medical treatment. There aren't any drug interactions known with this product, so we're good there. If you miss a dose, we're not really on too strict of a schedule, so if you miss one, I would say just skip that miss and then wash your hair with it the next time that you remember, next time you wash your hair. You're going to store it at room temperature. You probably just store it with the regular shampoo in your shower.
Okay.
Make sure the cap is closed tightly on it. And then just keep it away from heat and keep it out of the reach of children and pets. You're going to want to monitor your progress. So I guess just kind of if you're noticing less dandruff on your, on your clothing or coming out of your hair and stuff, then that's good progress.
Okay.
And then for non-pharmacological therapies, they say that just brushing your hair can actually help the dandruff because dandruff is caused by the buildup of oil in the sebaceous glands on your head, and so then that oil causes your skin cells to stick together, and that's why it comes off like that. So if you brush your hair, it actually brushes the oil down through the whole length of the hair follicle, so it can help it, kind of disperse the oil instead of being concentrated in one spot. And then if you just might want to stay away from, if you find other shampoos or cosmetic products that you use that might, make the dandruff worse or something. Just stay away from those. So do you want to run back some things that I told you?
Yes. So you recommended psyllium glue?
Selsun.
Selsun glue.
Yeah.
And I would apply this in my scalp, massage it in my scalp.
Mhm.
And the first time I do it, it's once daily per week.
Right, for 1 week.
And then I would switch to 2 to 3 times for 2 to 3 weeks.
Correct.
And then back to once daily.
No, back to just once a week.
I mean, once a week, yes.
So how long are you going to leave it in your hair when you're massaging it in?
Leave it in for 3 to 5 minutes.
Okay, good.
And then wash it, repeat it.
Rinse it out. Yep.
Okay.
What about some side effects?
Side effects, tingling.
Yeah, right. Yeah, it's going to tingle some. It could burn or itch. And then it might discolor your hair. That's one that's probably freaked people out. What about some more serious ones?
There's not.
Like the tremors,
Okay.
and then some GI issues. Some people have had GI issues. Let's see. If you miss a dose,
Not sure I'm worried about it.
yeah, just going to do it the next time you wash your hair. Storage,
Room temperature.
right. Just probably with the other shampoos.
Okay.
What about self-monitoring?
Just kind of look at it.
Just kind of
Because
keep it,
it's
yeah,
gonna
keep an
take-
eye on it, make sure it's working. And then for non-pharmacologic therapy.
Brushing my hair.
Right.
Sure.
And then when you're using this, if you don't see progress after the first 2 weeks of you using it, then it's probably an underlying condition and not just the dandruff. So we're going to want to seek medical advice from your primary doctor or even dermatologist.
Okay. Sure.
Okay. So do you have any other questions for either of us about either product?
Questions at all? About the acne or dandruff? No?
Okay, good
Well, I'm
deal.
glad we can help you. And hopefully that both of those things that we recommended will really
Okay.
help each issue. Okay? Nice to meet you.
Nice meeting you.
If you have any other questions, feel free to give us a call.
Yep.
Acne's coming off.
Yeah.
Yeah.
You fix that.
Yeah.
Doesn't usually come off in real life.
I have 1, 2, 3.
Should have add some more.
Can you see it now?
Is it, as long as it's showing on the is it showing on the camera?
Yeah.
Oh, yeah, that is.
Sorry, you gotta chill. You're the patient.
Girl, you need to. Hi, nice to meet you. Kendall, student pharmacist.
Hello.
What's that?
What color
Well-
is the dandruff? It's white. I'm just kidding.
That was not a tricky question.
I have acne.
No 3D.
3D.
It's going off again.
Oh no.
No 3D.
He was just sorry.
I have acne.
Can we know that already?
Okay.
Stages where you did have it, like normal people, or
Alrighty.
no? What were you thinking with this one? Like, stress.
Yeah. That.
Sorry.
So later we don't laugh.
She says, let's laugh it all out so later we don't
We've been laughing for an hour and a half.
Hi, how you doing today?
Hi.
What's your name?
Dahar.
I messed up. That flow sounds so weird.
The end.
Oh,
Oh, God.
Lord.